during this festival time. Today we have with us the members of the medical team from Renmin Hospital Beijing to Hubei. They are President Jiang Baoguo of the Renmin Hospital, Vice President Wang Tianbing, the team leader of the team, and also the interim CPC party secretary, and Dr. Cao Zhaolong, chief of the respiratory and ICU, Dr. Wang Ling, director of the nursing department, and Dr. Liu Zhongdi from the injury treatment center of the hospital. All of them are members of the medical team. Let me first give you the update of the pandemic. Yesterday, between 0 and 24 o'clock, China's mainland reported that for newly increased confirmed cases, the number is 12, including 6 overseas imported cases, respectively 5 in Shanghai and 1 in Fujian. 6 indigenous cases, specifically 5 in Heilongjiang and 1 in Inner Mongolia. There is no new fatal case, and there are 3 suspected cases. All of them are overseas imported in Shanghai. Yesterday, 32 cases are cured and discharged from hospitals. Close contacts removed from medical observation numbers 882, and the number of severe cases dropped by 3. For overseas importation, there are remaining confirmed cases 505, including 7 severe cases. And there are 7 suspected cases. In total, there are 1,670 cases confirmed and 1,165 cases cured and discharged from hospitals, and there's no fatal case. By the end of yesterday, China's mainland reported that for remaining confirmed cases, the number is 599, including 38 severe cases. In total, 77,642 cases are cured and discharged from hospitals, and 4,633 cases were fatal case. Confirmed cases numbered 82,874, and there are 9 remaining suspected cases. In total, close contacts traced numbered 732,966, and close contacts still under medical observation 7,761. In Hubei, yesterday there was no new confirmed case, suspect cases, nor remaining suspected case. And in total, 63,616 cases are cured and discharged from hospitals, including 46,464 in Wuhan. In total, the death tally reaches 4,512 in total, and there are 3,869 death cases occur in Wuhan. For confirmed cases, the total is 68,128 and 50,333 in Wuhan. For asymptomatic infection, yesterday, the newly increased number is 25. No overseas importation, and 6 cases were transferred to confirmed cases, including 1 overseas imported. Yesterday, 36 cases are removed from medical observation, including 11 overseas imported, and 981 cases, the asymptomatic infections are still under medical observation, including 115 overseas imported. In total, from Hong Kong, Macau, and Taiwan, the total confirmed cases reported reached 1,511, including 1,037 from Hong Kong SAR, 45 from Macau SAR, and 429 from the Taiwan region. Yesterday, on April the 30th, there are 6 newly increased indigenous cases in China, and they are all relevant with the overseas imported case. And altogether, we have 131 reported cases. Over 60% of them are from Heilongjiang, the cluster outbreak. and also altogether 864 cases have been reported, and more than 1,000 cases have been discharged from hospitals as they recover. Furthermore, the State Council has already notified the investigation results concerning the cluster outbreak in Heilongjiang. It emphasizes that we need to step up the in-hospital infection control capacity and come up with the specific and well-targeted measures against overseas importation and domestic resurgence. Now the floor is open for Q&A. Please first identify yourself. The floor is open. First question, on the right, on the front row, the first lady reporter, please. With CCTV, to deal with the COVID-19, the Renmin Hospital sent medical team to Wuhan. Could you please share with us the strengths and advantages of this medical team and what is the treatment result? We will have Dr. Jiang to answer the question. Thank you for your question, and also I'd like to thank the general public for your interest and support for us. In the pandemic, for 3 times continuously, specifically on January the 26th, February the 1st, and February the 7th, respectively. Altogether, we sent 134 colleagues to the Zhongfa ward in Wuhan to take over 1 ICU ward. In this process, the Renmin Hospital has watched very closely the developments in Wuhan, and also as we have a lot of volunteers, we followed the NHC's instruction and the requirement as we are to go to Wuhan to help treat the patients. We are considered as a national level medical team, and that's why you can find the composition and the ICU unit, the nursing unit, and also the injury treatment centers. So we work as a team and take over the whole ward in Zhongfa Xinchen Tongji Hospital. Also, we have sent our experts in nosocomial infection control. The leading figures in this field from our hospital are dispatched to Wuhan. I would also like to share with you an anecdote that previously we didn't plan to send an expert in the anesthesia, but we found that it might be necessary to send an anesthesia expert, and as for the intubing process, such expert might be needed. And of course, many of my colleagues enjoy experience in this aspect. However, from the anesthesia department, we do find the expert very good at hands-on experience as well as training. That's why we send 2 experts in this field, and they truly demonstrate great role in the frontline treatment, making the treatment very smooth and successful.
Similar things can be said with the IPC director. When we arrived on site, what was waiting for us was not an ICU ward, it was an ordinary ward, so we have to very swiftly change it to an ICU ward. The IPC director helped a lot in the first 24 hours. We completed the transformation from an ordinary ward to an ICU ward with the clear zoning. A team as such is multidisciplinary, and it is conducive for life saving. In retrospect, we have successfully treated many patients. The treatment rate among patients we've taken was 96%. I believe each and every medical team has made painstaking efforts and have summarized the great experiences. For us, when we arrived on site, we were faced with enormous number of patients, and we had to analyze individual patients. In the traditional sense, we had to take care of the pneumonia symptom, but for an ICU ward, a respiratory tract infectious disease patient, after it has been collected to ward, and we can cut off a transmission. With pneumonia and underlying diseases for 60-year and above patients were common. Almost a half of the 60-year-old patients had cardiac diseases or kidney diseases. 11 out of the patients we've received even had kidney failure. Previously, they had to go through dialysis treatment every 2 or 3 days. So very quickly categorized the patients into pneumonia only and pneumonia with underlying diseases. And another category was the patients with organ failures. So with clear clarification and categorization of the patients, we had better targeted treatment. For example, simple pneumonia, targeted treatment for pneumonia-only patients who can be discharged in 10 days' time, and we focused more on the patients with underlying diseases. We have been sharing such categorization experiences with other teams, and that was well recognized. What we also want to share with you is the bedside ultrasonic examination is important. We know CT image checking is very important to monitor the progress of the disease. However, it may enhance the risk of nosocomial infection. So for the patients in ICU wards, for any of their respiratory difficulties, we use the bedside ultrasonic test to monitor the progress. The third hospital affiliated to Peking University had formed a collaboration team with us, so that is even a more diversified multidisciplinary team for the consultancy of the treatment for severe cases. During our ward rounds, we had the consultation at 4 o'clock regularly. At 4 o'clock p.m. every day, this diversified multidisciplinary team composed of the medical teams from several hospitals have been very effective. The 3 hospitals affiliated to Peking University have never been engaged in such diversified and big scale of consultancy for a consultation for the treatment of diseases. And that have been a fresh experience for us as well. The overall treatment rate was 96%. Again, thank you for your question. Thank you. Next question, please. Journalist from the first row on the left side, please. Thank you. With Economic Daily, I remember when in the initial days of the outbreak, there was an acute shortage of medical supplies. What were the judgment made by our medical team, assistance medical teams, and how did we deal with the shortages, and when did the situation begin to be mitigated? I'd like to ask Vice President Wang Tianbing to take the question. Thank you for your question. As you have rightly pointed out, at the initial days, the shortage was national. Back then, our hospital, the People's Hospital, were also in great need of medical supplies, but we knew that Wuhan hospitals were in greater shortages, so each of our team members has brought with them toolkit, including the medical supplies and their daily necessity needs, to ensure when our team members arrived in Wuhan, they can immediately be involved in the treatment. February the 7th, when the 100 of us went to Wuhan, we were even more better prepared, and medical supplies were more. Apart from the standard supplies for each team member, there were public available supplies in a total of 130 boxes, including the protective gears, the goggles and masks, and other disposable PPEs. And in these two boxes, we also find ultrasonic machine and mobile lab equipment, and even an ECMO and its disposables, and also the monitors and ECG monitors and the SARS machines. So all these were brought with us to ensure we can immediately be engaged in the treatment. Even so, when we arrived in Wuhan, we still were faced with the shortages. So we collaborated with the Wuhan Tongji Hospital and the Concord Hospital and applied to the local government for further distribution. And the People's Hospital back in Beijing sent us several batches of medical supplies later. Apart from all these, another important supply channel came from donations from all sectors of societies, the volunteers, and enterprises. They have purchased supplies from home and abroad and transported the supplies to us. That came in handy help in dealing with the shortages. Despite of the shortages, the core supplies have been available throughout the process. In mid-March, supplies from across the country have been transported to Wuhan, ultimately solving the problem of shortages. Thank you. Next question, please. Journalist from the second row on the left side, please. Thank you. With the Yangtze Evening News, I'd like to thank medical team for your help to Wuhan. COVID-19 hit us by surprise. When you first arrived in Wuhan, how did you collaborate with the local health workers? How did you collaborate to save patients? And how did your home hospital or the People's Hospital help the frontline efforts? I'd like to ask Dr. Cao Zhaolong to take the question. Thank you for your question. Indeed, the prevention and control efforts have been an arduous war. The 60,000 plus health workers in Hubei and the 42,000 plus health workers from across the country have been collaborating with the local colleagues. Only with the synergy can we achieve the win in this battle. In the first batch of us arrived in Wuhan on January the 26th. There was a solid foundation that they built for us. They have put up the treatment and nursing protocols. They renovated the wards. They set up the steering committee. And all these have laid a solid foundation for the second, third batches of us. Altogether, there were 3 medical teams, and we were integrated into one and took over an entire wing of the Tongji Hospital. The entire formation of us was there to take over the wing of the hospital, and the doctors and nurses had a clear division of labors. But we were not very familiar with the hospital's nursing and treatment protocols. Therefore, we need to closely collaborate with the local health workers to get familiarized with the hospital's treatment and nursing protocols. We may have different drug administration practices and habits, so it was because of their support.
So we will have made a very good collaboration. And just now we talked about the infection of COVID-19. It is a multi-organ problem and may affect the heart system and the kidney system. Also, many patients have underlying conditions like high blood pressure and diabetes. So we concentrated these patients in the isolation ward. So that may cause difficulties in treating their underlying conditions. For example, we may have patients who have already received the liver transplantation. Even though the team is a team composed of multiple disciplinary experts, we cannot treat those very specific specialist diseases. That's why we have had close collaboration with the local medical experts to ensure the treatment of the patients. Another feature of our takeover of the ward is that in our ward there are 11 kidney failure patients. These patients used to have the dialysis in different hospitals in Wuhan. However, due to COVID-19, they were concentrated in our ward. And also there are many contraindications for the drug administration of the kidney failure patients or dialysis patients. So we need to adjust the doses and also many other practices. We need to communicate closely with physicians who are conducting the dialysis for the patients. As for the support we received from our headquarters, well, as it was in an extraordinary moment, sometimes patients may not be satisfied with the treatment they receive in the concentration ward. That's why in our team, as we didn't have an expert in treating the kidney failure, we sought help from the headquarters. So with such collaboration, we can ensure that patients can receive high-quality dialysis during the treatment of COVID-19. Also, in the ward, altogether there are 18 medical teams, or national medical teams sent to Wuhan and to our ward in particular. So we formed a temporary division of medical administration. And meetings. This is also a very good illustration of our collaboration. Also, every Monday and Thursday, we would have a joint discussion about the difficult cases as well as the death causes. Every day, we had the case discussion back in the headquarters. And by such mechanism, we wish to ensure the sound quality of treatment. Okay, let's continue the Q&A. On the right, on the second row, the third lady reporter, please. Thank you. With National Business Daily, it is reported that in the early days of the outbreak, the medical workers are also under big pressure, suffering from psychological stress. So how about the psychological support to the medical team? We will have Madam Wang to take the question. Thank you for your question. As we all know, COVID-19 is a brand new and highly infectious disease. Wuhan was the epicenter when our members arrived at Wuhan faced with this brand new infectious disease, and also there are so many cases, and our team members were far from home and from the familiar environment. So some people, some team members mentioned that they couldn't go to sleep, and they also talked about their anxiety and also the difficulties caused by wearing these PPEs. So they have various kinds of forms of anxiety. So we conducted individual trainings, and every time before they enter into the ward, we make sure that the PPEs are well used, and also we ask the team members to go into the ward in pairs so that they can help each other and try to address the problems together. By doing so, the anxiety can be eased a little bit. And also, I know people are quite concerned about wearing the protective gears. It was also a highly risky event. We were concerned about the potential contamination, and that's why we also requested that the team members should come and get out of the ward in pairs. So after 2 or 3 times, when people are getting familiar with such practice, they are no longer so anxious. Many people say that we are heroes or heroines, but we are just like all of you. We are ordinary people. In our medical teams, we have members who just got married or who had just had a new baby for only 8 days, but they sacrificed their personal lives and dedicated to the work. Let me share with you a true story of our one of our male nurses. He was a new father of only 8 days, and he felt very sad or upset leaving his wife and new baby. But his wife was also a colleague in our hospital, and she provided a lot of support to her husband. When he arrived at Wuhan, he got to know that his new baby daughter was allergic, having some skin rashes, and he was sad, but he didn't tell us. However, when we found out what he is going through, we tried our best to help him and his family. I can see that people are under pressure when working in the ward, but just as Dr. Jiang has mentioned, we have to make sure that all of our members are safe and sound. So every time when we have the core members meeting, we talked about the outstanding problems and the potential solutions. We try to optimize the whole procedure in receiving and treating the patients, and also try to enrich their spare time.
And also, we've taken some videos and sent this back to their family members. We celebrated team members' birthdays. We have psychological therapists to provide counseling in times of need. So being it at the Frontline or at our backyard, we have been collaborating with each other to ensure everything has been running smoothly. Journalist from the third row on the right side, please. Thank you. With Shenzhen Satellite TV, my question is, what has been the great difficulty during your treatment of the patients, and how did you solve the problems? I'd like to ask Dr. Liu Zhongdi to take the question. Thank you for your question. During the clinical treatment provided by doctors and nurses, and health workers did encounter difficulties because most of the severe patients were the local older folk, and they spoke dialects. We had difficulty in communicating with them, so our doctors and nurses will take time out of their breaks to learn from the local health workers to understand the local dialect so that they can speak and have dialogue with the patients. And on our protective gears, we will write our names down on our back so that the patients will know whom they should talk to when they are in need. There are 9 nurses in our team who originated in Hubei, so they were distributed in different separate units to facilitate the dialect communication. There were also some patients in the wards who can speak Mandarin really well, who can help us with the communication. Apart from all these, we may use gestures to communicate. And we will put up our thumbs to encourage patients. Stay strong, you can get through it. Most of the patients we've been treating were very supportive, but there were also patients who suffered from serious anxiety. We fully understand, and we tried to understand why. One older patient had several comorbidities after acquiring COVID-19. He didn't think he can get through it. He was very pessimistic. The prognosis and doctors and nurses have been repeatedly encouraging him to let him understand the disease and our treatment. We also use some examples of the cured patients to encourage him, to boost his confidence. There were also patients whose family members, many of his family members have been affected by COVID-19 and was going through treatment in different wards. We understandably, such patients feel lonely and didn't want to take any treatment. We tried many measures to provide psychological support, to talk with the patient. We were very attentive listeners to such patients. We also contacted colleagues from different wards to enhance the opportunity of communication among family members who have been affected by COVID-19 concurrently. And such measures have yielded results, and such patients have been cured. Journalist from the 4th row on the left side, please. Thank you. With Shenzhen TV. The medical teams have made a great contribution to the Hubei and Wuhan's efforts in treating patients. After you come back to Beijing, how did you go through the quarantine? What is the health status and psychological status of the team members? I'd like to ask Vice President Wang Tianbing to take the question. Thank you for your question. Yes, indeed. After the medical team completed their tasks, they went back to Beijing, and we were saluted. That will be an unforgettable experience for each and every of us. I remember on the 6th, when we withdrew from Wuhan, the local government leaders, the hospital leaders went to see us off in our hotels and at the airport. The colleagues in Tongji Hospital who have been fighting along with us, and also the local volunteers who have been helping us day and night, also joined the team to see us off. We have been fighting with each other for 70 days and plus. We have become the team members, and we even become friends and families. We took a coach to the airport. There were the police leading the fleet, and volunteers swarmed into the streets to see us off. And also on the street and on the buildings, we saw the scene of the local citizens. After we arrived in Beijing, the water wagon gates, which was the highest ceremonial level of salute, was paid to us as a tribute. Our hospital's leaders and all of our colleagues came to the airport to welcome us. During the entire day, we were excited and we felt the humble gratitude. We were quarantined in Shunyi district and Yanqing district. The volunteers from the work union have also been with us for 2 entire days and nights to provide food and drinks. The hotel has also prepared good diets and also books for us, even some small instruments for exercises when we have to stay in the rooms, and that helped a lot to recover from the tiredness. And all of us all of the team members have been well prepared to restart their daily efforts, and some are already taking work online. Next question, please. Thank you. With the Hong Kong Economic Herald News. Last year, on the 70th years anniversary of the founding of of our country, we saw ceremony in memorizing those who have sacrificed their lives in the fight against the 2003 SARS. And there were many of the martyrs were from the People's Hospital. And thank you for your comment and question. 25 of our team have participated in the 2003 SARS fight. We can easily associate this year's pandemic with the 2003 SARS. People's Hospital affiliated to Peking University has been one of the backbone force fighting against the 2003 SARS. So they have been working in the most difficult times, and such heroes and heroines have always been playing a demo role and giving us aspirations to fight along. I was also a member participating in the SARS relief team. I have been working in D10 hospital back then, and 2 head nurses were also involved in the 2003 SARS fight. So the 25 of us who had the experiences with the SARS fight were leading other younger colleagues.
Experiencing the 2003 SARS and the 2009 H1N1 at the national and hospital level, I think we have already accumulated some experience. At the national level, the development of the infectious disease prevention and control mechanism has been conducted, and also for the treatment of the severe cases in COVID-19, the country has also worked out the technical guidelines. The mechanisms indeed are in place now. For our hospital, as we have experienced the 2003 SARS, we attached great importance to the screening and treatment of the respiratory diseases. So for disease identification, case identification and treatment, we have been trained and equipped. Also, you asked about what we have gained after the 2003 SARS outbreak. What are the improvements? I think it is fair to say that there are many improvements. The first is about our treatment capacity. As we are now frequently tested by the infectious diseases, when COVID-19 broke out, we now have the experts, especially the MDT, the multidisciplinary team. And also in terms of the treatment of the cases in 2003, we used a lot of steroids, and this was improved. And I mean, the use of the steroids were improved in the treatment of COVID-19. This has helped the recovery of the cases. Another improvement is that in recent years, as we have accumulated experience in treating the respiratory diseases, we have gained experience in treatment like the non-invasive ventilation or even ECMO. So for patients with such needs, we can provide them with appropriate support and treatment. Also, our equipment is improved. In 2003, at that time, we didn't have ECMO. We didn't have the high-end oxygen therapy support or equipment devices. But now, in the COVID-19 outbreak, we brought with us the relevant devices to Wuhan, and also we enjoy a sound mechanism against the infectious diseases. Thank you. Thank you. Let's continue the Q&A. On the left, the third row, the journalist in black, please. Thank you. With the Beijing Broadcasting Network. This question is for Madam Wang Ling. In the Frontline, how about the nursing for the COVID-19 patients? Were there any challenges, and how did you solve the challenges? Thank you very much for your concern and support for nursing. Just as President Jiang has mentioned, we are a national team, and the ward we took over were mainly for patients with underlying conditions and also elderly patients. So it was not easy to provide nursing care, and we need also to providing nursing care to the patients who have had other underlying conditions. But in our work, we uphold our philosophy, that is to show our love, patience, dedication, and responsibility to provide best quality care. We have an old gentleman case who is more than 80 years old, and he was suffering from many underlying conditions. His family also was affected by COVID-19, so nobody could come to support and care for him. He came to the ward sitting on the wheelchair. He was very thin, and he was very upset. He was very upset. We moved him to the bed and found that in his diaper, it was quite a mess, and he was really suffering the pains physically and also mentally. So we thought that we should not only treat his diseases, but also to give him psychological support and care. In our medical teams to Wuhan, we had many nurses from different departments, and I am also one of the nurses who have the experience in treating the injuries. You know, it is not easy to do our work when we wore the personal protective gears, but I tried my best, and every time after the nursing treatment, the grandpa was really moved, and he thanked us repeatedly. There were so many touching stories. We do have patients whose whole family got affected and couldn't come to care for them. And also we had patients who haven't brought with them adequate daily necessities. So we have brought our own materials or supplies to them to support them. So it is said that the COVID-19 has had the social distancing, making people apart. But within the ward, we try to make the patients feel that we are their bosom friends, and we are helping them to recover and to defeat the virus. All of our nurses have maintained this working philosophy and have tried our best to save and help the patients. We can only allow one more question. On the right, on the fourth row, the third reporter, please. Thank you. With the cover, my question is for Dr. Liu. Now, the epidemic situation in China is very different from the days when you were in Wuhan. So how do you feel now? Is it your first experience to working in the medical team? And what is the most impressive thing? Thank you for your question. Actually, this was my first experience in Wuhan, and so is many of my comrades or my colleagues. We spent about 60 days there, and we were constantly moved by the Wuhan people and the patients. In our ward, there was a pair of mom and son. The mother was over 60 years old, and the husband passed away because of COVID-19. But the mom was very strong. I remember that once I went to her ward and I asked her if she has any further needs. And then she told me that, Dr. Liu, you should keep some distance away from me. You need to protect yourself because you are so young.
She was saying all this to me as if she was my mom. I was really touched. And later, this auntie was transferred to other wards, and her son remained in our unit to receive further treatment. But her son was really sorry and in great sorrow because of the passing away of his father. Our colleagues have tried every possible means to ensure enough psychological support is given to the son, and we set up the video calls between the auntie and the son. And I remember she said, "Your dad has passed away. You have your own family. Those who are still living must live well." and stay strong, son. I was in great sorrow when I saw this, because all these people were suffering from all these tragic experiences, and I can fully identify their sorrowness. Today marks the 25th day since I left Wuhan. In remembrance of all the days and nights in Wuhan, I can still not find ease at the heart. Many of our colleagues have experienced all these sorrows and happiness, and we have emerged from this fight stronger. We remember when we were there, we received a letter addressed to us by President Xi. That was a great inspiration and aspiration for us. For all those experiences in Wuhan will be valuable assets for all of us as the doctors and the physicians. We will cure, comfort, try our best to provide help, support to all the patients we may meet along the way. Thank you. Today, the experts, health workers, health professionals from the People's Hospital affiliated to Peking University have shared with us their experiences. Tomorrow we will have the health authority from Jiangsu province and also epidemiologists to take questions. We look forward to your continuous attention, and we conclude today's press conference. Thank you.